Part A. Extract 1. Questions 1 to 12. You hear an endocrinologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you feeling today?
Good morning, doctor. Honestly, I'm quite worried. I've been experiencing a lot of discomfort lately. My neck feels swollen, and I've been having this persistent fatigue that just doesn't go away, no matter how much I rest. I also have this strange sensation in my throat, like something is pressing on it, especially when I lie down. Sometimes my voice feels hoarse, and I get short of breath doing simple things like climbing stairs. It's not just that. I've been feeling unusually cold all the time, even when everyone else seems to be comfortable. My skin is dry and flaky. I've even noticed that my periods have become irregular, and I've gained weight, despite not changing my diet at all. And my hair is thinning out too.
I can understand why you're concerned, Mihiraa. It sounds like you're going through quite a bit. Have you tried any treatments or remedies so far to manage these symptoms?
Yes, doctor, I have. I started by taking some over-the-counter pain relievers like ibuprofen, thinking the swelling might be due to some kind of inflammation. I've also tried using warm compresses on my neck, but that didn't help much. A friend of mine suggested taking iodine supplements, so I've been doing that for the past few weeks. I've also been more mindful of my diet, trying to include foods that are supposed to be good for thyroid health, like fish and seaweed. But honestly, nothing seems to be making a difference.
I see. It's important that we get to the root of this. Before we proceed, could you give me a bit more detail about your medical history?
Sure, doctor. I haven't had any major health problems before this. I'm generally quite healthy. The only medication I take regularly is levothyroxine, which I was prescribed about 2 years ago when I was diagnosed with hypothyroidism. I take 50 micrograms daily. Initially, it seemed to help, but lately, I feel like it's not working as well. My thyroid function tests from about 6 months ago showed that my TSH levels were a bit high, but my GP said it was within the acceptable range, so we didn't adjust the dosage. Other than that, I occasionally take multivitamins, but that's about it.
Thank you for that information, Mihiraa. Now, does anyone in your family have a history of thyroid disorders or any other significant health conditions?
Yes, doctor. My mother has been living with hypothyroidism for about 15 years now. My grandmother had thyroid issues as well, though I'm not exactly sure what kind. I know they both had to deal with similar symptoms, especially fatigue and weight gain.
That family history is certainly relevant. It's good that you're aware of it. Now, let's move on to a physical examination. Let's take a closer look at your neck. I can see there's noticeable swelling here, especially on the right side. This could be an enlarged thyroid gland. I'm also palpating the area. Yes, it does feel enlarged, and I can feel some nodules as well.
Is it serious, doctor? What could be causing this?
Based on your symptoms, medical history, and physical examination, it's likely that you're dealing with a condition called goiter. We'll need to conduct further tests to confirm the diagnosis, including updated blood tests to check your thyroid hormone levels.
What's the treatment for this, doctor? Is it something that can be managed with medication?
Treatment for the condition depends on its size, the symptoms it's causing, and the underlying cause. We might also consider antithyroid medications if we find evidence of an overactive thyroid. In some cases, if the condition is causing significant symptoms or if there's a suspicion of malignancy, surgery might be necessary to remove part or all of the thyroid gland. But we'll decide on the best course of action after getting the test results.
That sounds like a plan, doctor. When should I come back for the tests?
I'll arrange for you to have the blood tests and thyroid ultrasound done within the next week. Let's schedule a follow-up appointment for next Friday.
Thank you so much, doctor. I really appreciate your help.
Extract 2. Questions 13 to 24. You hear a plastic surgeon talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you today?
Good morning, Dr. Luis. I'm all right, thank you. I've been feeling a bit self-conscious lately, which is why I'm here.
I see. What brings you in today?
Well, I've been thinking about getting a nose job for quite some time now. My nose has always been something I've been insecure about. It's a bit crooked, and there's a noticeable bump on the bridge. It's affecting my confidence, and I find myself avoiding social situations because of it.
I understand. It's important that you feel comfortable with how you look. Can you tell me a bit more about what you'd like to change?
Sure. I'd really like to have the bump on my nose removed, and I want the overall shape to be more symmetrical. I'm looking for a natural look, nothing too drastic, just enough to make my nose appear more balanced with the rest of my face.
That sounds reasonable. I'd like to go over your medical history before we proceed. Have you had any previous surgeries or medical issues I should be aware of?
Yes, I've had a few issues in the past. I've been diagnosed with mild asthma, for which I use an inhaler called Ventolin. I'm also on a low-dose medication for my thyroid called Synthroid. Other than that, I don't have any major health problems.
Thank you for sharing that. Asthma and thyroid issues are important to consider when planning surgery, but they shouldn't pose any significant risks. Let's move on to a physical examination. I'll take some measurements and assess the structure of your nose. I'm going to measure the width of your nose at the bridge, which is about 30 millimeters, and at the base, it's around 35 millimeters. The bump you mentioned is approximately 4 millimeters in height. Your nasal tip is slightly drooping, which we can also address. Based on your description and the examination, it seems like you'd benefit from a rhinoplasty, specifically for dorsal hump reduction and tip refinement. This will involve removing the excess cartilage and bone causing the bump and reshaping the nasal tip to achieve better symmetry.
That sounds good. Could you explain the procedure in more detail? That sounds good. Could you explain the procedure in more detail?
Certainly. The procedure typically takes about 2 to 3 hours under general anesthesia. We'll start by making incisions inside the nostrils or across the columella. Through these incisions, we can access the bone and cartilage, reshape them, and correct any deviations. We'll then refine the tip and ensure the nose looks proportional to your face. After that, we'll close the incisions with sutures and apply a splint to help the nose maintain its new shape during healing.
And what about the recovery process? What should I expect?
Post-operatively, you'll experience some swelling and bruising, particularly around the eyes, for the first week or so. We'll prescribe pain relief medication like Tylenol and possibly a course of antibiotics such as amoxicillin to prevent infection. You'll also need to avoid strenuous activities for at least a month. The cost for the entire procedure, including the surgery, anesthesia, and follow-up visits, will be around $7,500.
That sounds reasonable. Are there any risks I should be aware of?
As with any surgery, there are risks such as bleeding, infection, or an adverse reaction to anesthesia. There's also a chance of dissatisfaction with the aesthetic outcome, though we'll work closely together to ensure we meet your expectations.
Thank you for explaining everything so clearly, Dr. Luis.
In some cases, a revision surgery might be necessary, but that's rare.
I understand. I feel more confident about going forward with this.
I'm glad to hear that, Mihiraa.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a GP called Mihiraa talking to a patient. Now read the question.
Congratulations, Mrs. Peter, on your pregnancy. It's important to discuss your epilepsy management during this time.
Thank you, doctor. I'm excited but also a bit nervous. I've heard that epilepsy can affect pregnancy.
It's true that epilepsy can pose some risks during pregnancy. However, with proper management, you can have a healthy pregnancy and baby.
What are the potential risks?
The risk of seizures may increase during pregnancy, especially in the first trimester. It's important to take your anti-epileptic medication as prescribed and monitor your condition closely.
Are there any medications I should avoid?
Some anti-epileptic medications may not be safe during pregnancy. We'll need to review your current medication and make any necessary adjustments.
I'm also concerned about the impact of epilepsy on the baby.
While the risk of birth defects is slightly increased in women with epilepsy, with proper management and prenatal care, the risk can be minimized. Regular prenatal checkups and monitoring are essential.
Now look at question 26. You hear a pharmacist called Mihiraa talking to a patient. Now read the question.
Mr. Peter, I'm prescribing you codeine for pain relief. It's important to follow the dosage instructions carefully.
Okay, Mihiraa, I will. I've heard that codeine can be addictive. Is that true?
While codeine is an opioid, the risk of addiction is lower compared to stronger opioids. However, it's important to use it as directed and avoid long-term use.
I'm also concerned about potential side effects.
Common side effects include drowsiness, constipation, and nausea. If you experience any severe side effects, such as difficulty breathing or unusual drowsiness, contact me immediately.
I'll be sure to do that, Mihiraa. How long should I take this medication?
Your doctor will determine the appropriate duration of treatment based on your symptoms. It's important to follow the prescribed course and not stop taking it abruptly.
Now look at question 27. You hear a physiotherapist called Mihiraa talking to a patient. Now read the question.
Mr. Peter, before we begin your physiotherapy sessions, I want to discuss some potential risks associated with the treatment.
Sure, go ahead, Mihiraa.
While physiotherapy is generally safe, there's a small risk of discomfort or soreness during or after the sessions. It's also possible to experience temporary muscle soreness or fatigue.
Is there a risk of injury?
While injuries are uncommon, there's a slight chance of overexertion or straining muscles if the exercises are done incorrectly. That's why it's important to follow my instructions carefully and listen to your body.
What if I experience pain during the session?
If you feel any pain, please let me know immediately. We can adjust the exercises or take a break as needed.
Is there a risk of making my condition worse, Mihiraa?
In rare cases, improper physiotherapy techniques or excessive exertion could potentially worsen your condition. However, with proper guidance and adherence to the treatment plan, the risks are minimal.
Now look at question 28. You hear a nursing manager called Mihiraa conducting a morning meeting. Now read the question.
Good morning, team. I'm excited to announce that we'll be replacing the bedside switches in all patient rooms with a new, upgraded model.
That's great news, Mihiraa. What are the new features?
The new switches are designed to be more user-friendly and intuitive. They have larger buttons and clearer labeling, making them easier for patients to use. Additionally, they are equipped with a call button that directly connects to the nursing station.
That's fantastic. This will improve patient satisfaction and reduce the risk of falls.
Exactly. Patients will have better control over their environment and can easily call for assistance if needed. We'll also be providing training to our staff on how to use the new switches effectively.
Will there be any changes to the emergency call system, Mihiraa?
Now look at question 29. You hear a nurse called Mihiraa talking to a junior nursing staff. Now read the question.
Liza, today we're going to discuss the proper insertion and care of subcutaneous cannulas. These devices are essential for administering medications and fluids to patients.
I understand, Mihiraa. I've seen them used before, but I'm not sure about the correct technique.
The key to successful insertion is to identify a suitable site, clean the area, and insert the cannula at the correct angle. Always refer to the manufacturer's instructions for specific guidelines.
What are some common complications associated with subcutaneous cannulas?
The most common complications include infiltration, where the fluid leaks into the surrounding tissue, and phlebitis, which is inflammation of the vein. It's important to monitor the insertion site for any signs of redness, swelling, or tenderness.
How often should the cannula be changed, Mihiraa?
The frequency of changes depends on the type of cannula and the patient's condition. Generally, they should be changed every 72 hours or sooner if there are signs of complications.
Now look at question 30. You hear a dentist called Mihiraa talking to a dietitian. Now read the question.
Mihiraa, I'm concerned about Mr. Peters' swallowing difficulties. He's had a recent stroke, and his swallowing seems to be impaired.
I understand. Swallowing problems can be a significant challenge after a stroke. We can work together to develop a plan to address his needs.
I've referred him to a speech therapist for a swallowing evaluation. In the meantime, I'd like to discuss dietary modifications that might help.
Absolutely. We can adjust his diet to ensure it's easy to swallow and nutritious. We can recommend pureed foods, thickened liquids, and small, frequent meals.
That's a good idea. I'm also concerned about his risk of aspiration. Are there any precautions we should take?
Yes, it's important to position him upright during meals to reduce the risk of aspiration. We can also recommend specific swallowing techniques to improve his swallowing function.
Thank you for your advice, Mihiraa. I'll coordinate with the speech therapist and ensure that Mr. Peter receives the necessary support. Thank you for your advice, Mihiraa. I'll coordinate with the speech therapist and ensure that Mr. Peter receives the necessary support.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a microbiologist, Dr. Mihiraa, and an interviewer.
Good afternoon, Dr. Mihiraa. Thank you for taking the time to discuss your groundbreaking research on rhinovirus. To start, could you briefly explain what the main focus of your study is?
Thank you for having me. My research centers on understanding the molecular mechanisms underlying rhinovirus infections, specifically how the virus interacts with host cells at the genetic and protein levels. We aim to uncover the factors that make certain strains of the virus more virulent and explore why some individuals experience more severe symptoms than others. Our study also delves into the role of the immune system, particularly how it responds to the virus during the early stages of infection. We are particularly interested in how variations in the human genome might influence susceptibility to the virus and the severity of the illness. So, in essence, our study has a dual focus: the virus's biology and the host's response.
That sounds incredibly comprehensive. How did this extensive study begin, Mihiraa? What was the initial spark that led to this research?
The inception of our study was somewhat serendipitous. Initially, we were investigating respiratory infections more broadly, but during our preliminary analysis, we noticed an intriguing pattern in rhinovirus cases that warranted deeper exploration. We started by examining archived clinical data, which revealed distinct differences in how the virus affected various demographic groups. This led us to hypothesize that genetic factors might play a significant role in these variations. We began our research by conducting detailed genetic analyses on a large cohort of patients, looking for commonalities that might explain the differences in immune response and disease severity. As our understanding evolved, we shifted our focus more narrowly to rhinovirus, given its prevalence and the unique challenges it presents in terms of both public health and clinical management.
With such a complex study, I can imagine there were numerous challenges. Mihiraa, could you share some of the most significant obstacles you encountered during your research?
Absolutely, the challenges were manifold. One of the most significant hurdles was the sheer genetic diversity among the patient samples we studied. This diversity made it difficult to pinpoint specific genetic markers associated with susceptibility or resistance to the virus. Additionally, rhinovirus itself is highly variable, with over 160 known serotypes, which complicates the process of drawing broad conclusions from our data. Another major challenge was the need to balance in vitro studies with in vivo findings. While we could control variables in the lab, real-world conditions presented a different set of complexities, particularly when it came to the immune response, which is influenced by a multitude of environmental and genetic factors. Furthermore, we faced technological challenges, particularly in sequencing the viral genome in a way that allowed us to compare it accurately across different samples. These obstacles required us to continuously adapt our methodologies, often integrating new technologies and approaches as our research progressed.
Despite these challenges, your team has made some impressive strides. What are the latest developments in your research, Mihiraa?
One of our most exciting recent developments is the identification of a specific protein that appears to play a critical role in how rhinovirus evades the immune system. We've discovered that this protein, which we've provisionally named RV immunomodulator, can interfere with the signaling pathways that typically alert the immune system to the presence of a virus. Our experiments have shown that when this protein is inhibited, the immune system can respond more effectively, potentially reducing the severity of the infection. This finding opens up new avenues for therapeutic intervention. Additionally, we've made significant progress in our understanding of how different rhinovirus strains interact with various receptors on human cells. This could explain why certain strains are more prevalent or cause more severe disease in specific populations. These developments are bringing us closer to identifying potential targets for new antiviral treatments, which could significantly improve outcomes for patients.
These findings are truly remarkable. Given these developments, Mihiraa, what do you expect the outcomes of your study to be?
Our ultimate goal is to develop a more comprehensive understanding of the factors that influence rhinovirus infections, which we believe will lead to more effective treatments and preventive strategies. We hope to identify biomarkers that can predict the severity of an infection, allowing for more personalized approaches to treatment. For example, if we can determine that a patient has a genetic predisposition to severe rhinovirus infection, we could potentially intervene earlier or use more aggressive treatment strategies. Moreover, we anticipate that our findings on the RV immunomodulator protein could lead to the development of novel antiviral therapies that specifically target this mechanism, thereby boosting the immune response and reducing the impact of the virus. In the broader sense, our research could also inform vaccine development, particularly in creating vaccines that are effective across multiple rhinovirus serotypes.
The implications of your research seem vast. What do you think will be the broader impact of your study, both within the scientific community and in public health?
The impact of our study could be profound on several fronts. Within the scientific community, our findings could spur further research into the molecular mechanisms of other common viral infections, potentially leading to broader applications in virology and immunology. We hope that our identification of the RV immunomodulator will open up new research directions in viral immune evasion strategies, which could have implications for understanding other pathogens as well. From a public health perspective, our work could lead to better management of rhinovirus infections, particularly in vulnerable populations such as young children, the elderly, and those with chronic respiratory conditions. By providing insights into why certain individuals are more severely affected by the virus, we can contribute to more targeted public health strategies, potentially reducing the overall burden of respiratory infections. In the long term, our research could also pave the way for more personalized medicine approaches in treating viral infections, leading to more effective and efficient healthcare solutions.
Now look at Extract 2. Questions 37 to 42. You hear an occupational therapist, Mihiraa, talking about the aspects of her professions. You now have 90 seconds to read questions 37 to 42.
Good day, everyone. My name is Mihiraa, and I am an occupational therapist with over a decade of experience working with individuals to regain independence in their daily lives. Today, I will walk you through some of the crucial aspects of my profession, exploring how I support patients, the challenges I face, the memorable moments that have shaped my journey, the tools I use, and the importance of working within a multidisciplinary team. I'll also discuss some of the latest advancements in the field of occupational therapy. Supporting a patient as an occupational therapist involves more than just addressing their physical needs. It requires a holistic approach. My primary role is to help patients develop, recover, or maintain the skills needed for daily living and working. This includes evaluating the patient's physical, emotional, and social conditions. For example, when working with stroke survivors, I focus not only on their physical rehabilitation, such as improving their motor skills and coordination, but also on their emotional well-being, ensuring they regain confidence and a sense of autonomy. My approach is individualized, meaning that each patient's treatment plan is unique and tailored to their specific needs and goals. I often collaborate with patients to set realistic, achievable goals, which could range from being able to dress themselves to returning to their workplace. I also use adaptive techniques and tools, such as assistive devices, to facilitate independence. In my career, I've encountered numerous challenging situations, but one that stands out involved a patient with severe traumatic brain injury, TBI. This patient, let's call him John, had lost not only his motor skills, but also much of his cognitive function, including memory and the ability to communicate effectively. The challenge was multifaceted. It was not just about restoring his motor abilities, but also about helping him rebuild cognitive functions that are often taken for granted, like recognizing family members or even understanding time and place. John's rehabilitation required a highly coordinated approach involving cognitive therapy, physical rehabilitation, and emotional support. His progress was slow and often inconsistent, which was frustrating for both him and his family. I had to constantly adapt my strategies, focusing on small victories, such as getting him to recognize basic objects or respond to simple commands. The emotional toll on his family was immense, and part of my role was to support them through this journey, helping them to understand and cope with the reality of John's condition. The situation required me to balance optimism with realism, providing hope without making promises that couldn't be kept. There is one patient who left a lasting impact on me, a young woman named Sarah, who had been diagnosed with multiple sclerosis, MS. Sarah was in the early stages of her diagnosis, and the progressive nature of MS meant that her abilities would decline over time. What struck me most about Sarah was her resilience and determination. Despite knowing what lay ahead, she was committed to maintaining her independence for as long as possible. Working with Sarah was both inspiring and heartbreaking. We worked together on various adaptive strategies to manage her daily tasks as her condition evolved. This included everything from energy conservation techniques to using assistive devices that would help her remain independent at home. What made Sarah unforgettable was her attitude. She was always optimistic, even on days when her symptoms were severe. Her determination to live life on her terms, despite her declining abilities, taught me the importance of focusing on what patients can do, rather than what they can't. The tools and equipment I use as an occupational therapist are as varied as the patients I treat. These range from basic assistive devices, like grab bars and reachers, to more specialized equipment such as dynamic splints and sensory integration tools. Each piece of equipment serves a specific purpose and is chosen based on the individual needs of the patient. For instance, dynamic splints are used to improve joint mobility in patients with conditions like arthritis, while sensory integration tools help children with autism develop better motor skills and body awareness. One of the most advanced tools I work with is a robotic-assisted therapy device. This device helps patients who have suffered from strokes or spinal cord injuries regain movement in their limbs. It provides real-time feedback, which is crucial for adjusting therapy in real time. The selection and use of equipment are always tailored to the patient's specific condition and goals. It's not just about using the most advanced technology, it's about choosing the right tool for the right patient to maximize their recovery and independence. Collaboration is the cornerstone of effective patient care. As an occupational therapist, I often work as part of a multidisciplinary team that includes physiotherapists, speech therapists, doctors, nurses, and social workers. Each team member brings their expertise, and it's crucial that we coordinate our efforts to provide comprehensive care. For instance, while I focus on improving a patient's ability to perform daily tasks, the physiotherapist might work on their mobility and the speech therapist on their communication skills. We have regular team meetings to discuss each patient's progress and adjust our treatment plans accordingly. Effective communication is key in this setting. We must ensure that all team members are on the same page regarding the patient's goals and progress. This requires not just formal meetings, but also day-to-day interactions where we share observations and insights. The ability to work seamlessly with a multidisciplinary team is essential for delivering holistic care that addresses all aspects of a patient's recovery. The field of occupational therapy has seen significant advancements in recent years. One of the most exciting developments is the use of virtual reality, VR, in therapy. VR allows patients to engage in immersive, simulated environments where they can practice real-life skills in a controlled setting. For example, a stroke patient can practice daily activities like grocery shopping or cooking in a virtual environment, which can be safer and less intimidating than trying these tasks in the real world. Another significant advancement is the growing emphasis on mental health within occupational therapy. Traditionally, OT has focused more on physical rehabilitation, but there is now a greater recognition of the importance of addressing mental health issues as part of the recovery process. This includes techniques such as mindfulness and cognitive behavioral therapy, CBT, which are integrated into OT to help patients manage anxiety, depression, and other mental health challenges that can arise from or exacerbate physical conditions.
That is the end of your OET listening test. Now check the answers.